Okay, we're here with Dr. Supa from Sydney, Australia. Hi, Dr. Supa. How are you?
Okay, thanks. How are you?
Good. How are things in Australia?
It's pretty good.
Pretty good. What's so good about it?
So it's a little bit cold.
That's good. Okay.
Yep.
So we met during my course in Sydney a few months ago, and you took all the information you learned and you started to perform aesthetic crown lengthening. You showed me some of your cases. Great results. Your patients were very, very happy. But as you keep practicing, keep performing, you are encountering some challenges and some complications, and you wanted to share a case with me and get some advice. And tell me what was her concern and what was your goal.
Yep. She came to me first off complaining about she didn't like the appearance of the black triangles between her crowns. Now, she had 3 PFM crowns done about 10 to 15 years ago. Ever since, she had some periodontal conditions which caused gingival recessions and showing dark margins around the gum as well. Now, in the last 3 months, I've treated her periodontal conditions. So right now they're pretty good. There's no bleeding on probing. The pockets are normal. So now we're looking at fixing the cosmetic issues now. The goals that I was looking at was to replace these crowns with all ceramic crowns. But what I mentioned to her was that the gingival margins around these crowns were not even, and maybe that we can incorporate some aesthetics crown lengthening with the restorative work as well to get a better result. So the first thing I did was, following your advice, is actually just to do a quick, easy mock-up first. So using, I think it's Photoshop elements.
Exactly.
And just move the margin. Now, this photo is just the first one. We're just showing her that if we just do the changing to a new crown without doing the lengthening, this is what sort of result that she may get. And then comparing to actually even out all the gingival contour as well, to achieve the better result. And she was pretty happy with the second picture, which is the crowns with the higher up gingival margin on teeth 1 and 1, 2.
Okay, I think you did great. So you did a gingivectomy on the lateral incisor and then the central incisor.
Yep.
And what happened next?
I raised the flap, and I'm using the papilla saving incision.
So what happened next? What was the problem actually that you had?
Yeah. Well, actually, everything's went well. I removed the bone to the right to make sure that they're even on both teeth. On the 2 lateral incisors.
Okay.
And then once I'm done with that, I sutured the teeth up. But my concern was actually I didn't remove any bone on the gingival margin of the tooth 2-1. But yet once I've actually sutured the gum back together, we're getting about 0.5 mil to 1 mil recession on tooth 2-1 as well.
Okay. Did you remove any bone interproximally?
I did remove some bone between the 1-1 and 2-1. Just because I just want to get, when I actually raise the flap, I feels like the shape of the bone around the tooth 1-1 is quite squarish. So I just like to get the nice contour in between the tooth 2-1 and 1-1 as well.
Okay.
So I just run the round burrs just right in between the 2 teeth a little bit.
That's probably, Dr. Supa, that's probably the source of the problem, because if you do any type of ostectomy, even osteoplasty, meaning just reshaping the bone between the centrals, this layer of bone that was tenting the tissue is not there anymore. Therefore, the tissue can recede on you, and it can recede on both teeth on each side, because the bone may have not been there in the first place, number one. And number 2, as you suture, you see you're suturing, I think you used simple interrupted sutures. They're pulling the tissue apically. And if there's no bone to resist it, you will get the recession. So I think the lesson learned here is to be extremely conservative, or not remove any bone between the teeth. The only area that you want to remove bone is on the buccal aspect of the tooth between the line angles. But right in here, let me just zoom in a little bit. I think the bone that you removed in this region, and potentially where the interproximal bone is, I think this is what caused the recession on the adjacent tooth. Is this point
Yep.
pretty clear?
Yep.
Okay. So Dr. Supa, I admire you for practicing and trying and even failing, because that's a part of your success, and you will learn that the more failures you are, you're learning more, and you will improve your techniques. I'm going to mail you an audio program on crown lengthening. Okay, you'll be the first one in the world, once you get it, to listen to this audio program. It's 6 hours of audio on crown lengthening, functional, aesthetic, complications, how to set up your operatory, how to communicate with patients and staff. Well, say hi to everybody in Sydney, Australia. I hope this was helpful to you, and keep me posted on this case.
Yep.
Okay?
Yeah.
Good, my friend. All the best. I'm going to move you to the other side. Is that okay with you?
Yep, that's fine.
Okay, don't get too dizzy when I move you, okay?
Yeah.